Well, at first, for most stage 1 seminoma, you can perform active surveillance and just follow the patient on a very strict base. But if you go for treatment, then there has been this historically decision making, certainly in Europe, that radiotherapy should not be offered anymore because, according to those colleagues, it induces much more secondary tumors than chemotherapy. However, the radiotherapy schedules and the technology that they use to make this statement are very old and should not be extrapolated in the current setting. With modern radiotherapy, for instance, with what we call arc therapy, and certainly with proton therapy, which is coming up, the incidence of secondary tumors will be far less than it's with historically schedules. Number two, when you look at the statistics of this famous paper that was published in GCO, it's a non-inferior trial, which is not the same as equal. Non-inferior is something totally different, and for a purely statistical viewpoint, it was not non-inferior. It was so. I think that radiation oncology has been kicked out far too early, and that if a patient needs treatment for stage 1 seminoma, it should be explained two different ways, being carboplatin or being modern radiotherapy, also to a far lower dose, because now we know that a dose of 20 gray is sufficient to treat these patients, while all comparisons were made with schedules of 30 gray and more. And the higher the dose you give, the more chance that you also have developing secondary tumors. So that's also an extra point in favor of radiotherapy, that you can give far lower doses than historically. Secondly, or thirdly, the follow-up of those studies with carboplatin are very limited. So the real results are the long term we don't know yet. I'm not saying that you cannot go for carboplatin, it's fair to do so, but you cannot kick out radiation oncology because of historical data. This is scientifically not fair, and therefore we published this paper with a whole group of American and European radiation oncologists and urologists who are into the research of urologic tumors to give a wake-up call to the community. I think this is the main message.